Good afternoon, everyone. How's everybody doing today? My name is Dan Harrison. You know me. Welcome to another episode of NuPath Live this Thursday, November 12th. It's been another busy week for all of us as we continue to live in a new world full of COVID and surveillance testing and the crazy national election that we're still kind of all adjusting to. And and I am looking forward to our episode today. Have two strong advocates, legislative advocates that we've invited to join us that are also happen to be mothers of people that we serve. So we're looking forward to talking to them in a couple of minutes. Legislative advocacy. Normally we talk about the statistics, the data related to COVID deaths, but we can take another little break from that today, although it's extraordinarily important. But we're going to talk about legislative advocacy because this past week you received an email blast from me really imploring you to take a moment to contact your state representatives. And I thought I'd take a couple of minutes first to just kind of explain briefly the outline of what we're asking for in this document. I want to thank everybody that took the time to do it, and I'm going to tell you about my own experience in a minute. But first, there were three specific amendments that we asked our legislators, or we were asking you to ask your legislators to sign on to. The first two have to do with what's called Chapter 257. And just to give a basic background, Chapter 257 is a law that was passed back in 2008, I believe. It took several years before it could be implemented, but what it essentially did was established a uniform rate sort of structure for the business of the human service providers. For many, many years, providers all over the Commonwealth have operated different residential programs, and they were funded all at different rates. People were attending day programs of all sorts and all over the state at all different rates per person. And the Commonwealth, after many years of strong advocacy that vendors, meaning providers like NuPath, had been engaging in, were finally successful in getting the legislator to pass these uniform rates. And that's what's known as Chapter 257. Now, part of 257, which was a huge thing for providers to finally have this uniform rate, because it also increased the value to not nearly enough, but it helped us a great deal when it finally went into effect in 2013. But part of it was there were going to be regular points of review along the way in which the state would say, based upon the cost of living, inflation, how much things are going up, we are going to increase these rates by X percentage, according to a number of complex formulas that were built into the law. This rate adjustment had not happened, and so there was a lot of activity around that. Finally, it was announced this past January that we would get a long-anticipated increase to our rates. Now, for an organization like NuPath, that would have amounted to about $500,000 per year of increase. So we were pretty psyched. It wasn't going to happen until July 1st, and I don't want to get too in the weeds here, but it wasn't going to be. We were going to get the money until October, and it would be retroactive to July 1st, meaning that from July 1st on this past year, we would be paid at the new rates. Then COVID happened, then everything went off the rails. So while at the same time that we're dealing with all the additional costs of managing the COVID pandemic, as we are losing revenue for day programs that are only very partially full, at the same time, this rate increase that we had been budgeting for was put on the back burner. And then we were recently notified that we would not be getting it this year. It would become effective January 1st. So we would only be getting half as much for the fiscal year. So the first two amendments have to do with insisting that the Commonwealth honor the rate increase as it was determined, and that we receive the rates going back retroactively to July 1st. So that is a critical part. The third amendment has to do with allowing staff that are working in residential programs during the day, because people are home or because they're not attending programs because of COVID, the stay-at-home, that providers would be getting money to reimburse for those schedules. And then the fourth one, which is the biggest part for us, is that we would be able to receive NuPath some amount of money to allow us to maintain our day services and keep them intact, even as many people have not yet had a chance to come back, knowing that, and we hope that in very short order, or at some point in the near future, we'll be able to get all of these members of our family back into their day programs. And without that money, organizations like NuPath are having to make some very difficult decisions and have conversations they probably never imagined having. I introduced one of those conversations last week when I talked about the Martin Center being a program that we were considering on the docket for closure. And Dan Lanen and I are going to talk a little bit more about that at the end and explain to people just what that means. I know there was some worry that some of our folks had upon hearing that. Don't worry, we're not abandoning anybody. When we talk about closing the Martin Center, it's really more has to do with the physical structure of that. But I want to move on in just a quick minute and talk to our first guest. But first, before that, I'd like to introduce you to my own state representative, Richard Haggerty. Rich is somebody that's been a friend of NuPath for many, many, many years. I've known Rich for a long time, and he is an amazing supporter to our industry and an advocate to people living with ID and DD across, specifically his area being parts of Reading and Woburn. I moved to Woburn officially about a year ago, and Rich became my official state representative. So it's been a pleasure to vote for him now in the primary and in the general election. Of course, I mailed in my ballot early to vote for Rich. But I had an occasion last Friday to call Rich in advance of this week, where I knew that the House was going to be having these debates. And Rich was very gracious in talking to me, and that I was able to forward him some of the particulars of what our requests were. The impact of the email blast, however it came to families, was very encouraging to me. And I've had the pleasure of hearing back from so many people that have taken the time to just send a simple email out. People from our own employee base. Brian Ellsworth is a big name that always comes to light. Thank you, Brian. And then a number of our families and people that said, "Hey, Dan, just want to let you know, just wanted to check in and let you know it's done." I couldn't feature all of screenshots for all of the emails I got, but guys, thank you. Thank you so, so much for taking the time. And it kind of prompted me to think about an idea of asking two who have mothers, I said it before, who have been particularly strong advocates. And in this recent round of advocacy, we've had a chance to see their handiwork. And we're going to talk to Ruthie and what we're calling NuPath Friends and Family.
You're strong.
Ruthie Lieberman, how are you? It's so nice to meet you.
I'm great. It's nice to talk to you, Dan.
You know, a couple of days ago, when I was thinking about when I was getting emails from families that were saying, "Hey, I want to let you know we did it. This is what we did," and I shared the idea with Brett Riley. Brett did some outreach, and he called. He was so excited. You'll never guess. I found the perfect person to talk to. Her name's Ruthie Lieberman, and now you've been with our organization for 5 years or so. Your son Aaron is in our program, and even though he's not yet coming back, you are quite familiar with the whole system. He lives in another residential agency, and but more than your own personal experience, you are the vice president of public policy for a group called Empath. So you know a thing or two about public policy. Can you just talk to us a little bit about what your experience is with that, and how you took upon this call to action, and how you responded?
Okay, great. Well, yeah, I have been working with a wonderful organization called Empath, Economic Mobility Pathways, for many years. We're based in Boston, a nonprofit. We're focused on helping low income people move out of poverty. And a part of our strategy, in addition to doing the direct service work like you do at NuPath, serving people and families individually day by day, we believe in system change. And so we have this public policy advocacy department. We have two full-time staff people, and we create a legislative agenda, just like there is for people with IDD and DD, about policy issues, mostly at the state level, that will help the journey out of poverty for families in Massachusetts. So for the past more than 10 years, I've been a registered lobbyist. I call and talk to state representatives all the time. And because of that experience, I know the huge impact that calls from constituents can have on an elected official. Massachusetts is a pretty small state, and if a state elected official gets 10 calls from the district, that can make a big difference. And so I also know that they are just regular people. They're neighbors in our community. I'm not afraid to call them or to write to them. And when an agency like NuPath sends the information so concisely in an email, all I really have to do is forward it to my elected officials. So I forwarded it to Michelle Chicolo. I put a few sentences in. I said, Aaron, he's 27. He lives in a group home. These amendments directly impact him and our family's well-being. And I ask you to please support these amendments. And she wrote back to me in probably in 15 minutes and said that she was definitely signing on to two of them and she would consider the other two. And she's gotten a request to sign on to 7,000 amendments.
I'm
So
sure. Yeah, 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 yeah. I loved what you said. So many important things. I hope I can remember to touch on them all. But you said they're just regular people, and I remember when I was a young person just getting into this field, and there was all kinds of advocacy required at the time. And I remember feeling so shy about picking up the phone and calling my state rep like they were some big hot shots, or they were, oh, I couldn't possibly, like, what would they want to know from me? But they are just regular people. They are citizens in the communities where we vote, and more than that. And I'd be interested to hear your thoughts on this. I think that in many cases, state reps and our elected officials, they are looking for these stories, these anecdotes about regular people. You reminded them of your son and how old he was, and this gives them talking points if they want to be able. I mean, how many times do we hear in a State of the Union address, oh, I talked to so and so, an electrician, or this in Ohio, or in Massachusetts, and I think that I look at it as doing them a favor, that we need to let them know what's going on the ground.
you are so right. I mean, I've had legislators tell me, that they remember this one person impacted that I brought in, or the stories, and they'll tell it over and over for years. So the stories are really important. And whenever I can have Aaron, be a part of that, that's even better.
Mhm.
And just on a humorous side, there have been times when the funding has been really tight, and I've been so worried. And I always thought my secret weapon is I'm going to take Aaron to the state house. I'm going to let him slip into the governor's office, and I'm going to disappear. And you could be sure that they're going to increase the
Yeah.
funding after we spend a few hours with the son. So
That's right. I've said something similar. It's like we'll take somebody, put them in a car by themselves outside. Look like we left them in the vehicle. And we'll get attention of a lot of people in a hurry, letting them know that there are serious consequences to what's going on. I only have you for another minute, but you are somebody who you've not quite worked out the details of the COVID pandemic as far as getting transportation, getting Aaron back, and that's something that I'm certain is fundamentally important to you to try to return to some normal kind of rhythms. So this is still continuing impact you and Aaron, your family, isn't it? This whole pandemic and frankly the lack of funding that we have.
Right. Yeah, it does. I mean, and fortunately, Erin is in a group home, but for the parents who have their kids at home, my heart, just goes out for them. I don't know how they are supporting their kids through
Mhm.
this time. It's really difficult.
But even people that are in group homes and not going out, I worry about them because I worry about the lack of, change. Like if I'm at home too long, I go crazy, and a lot of times our folks are living with people they did not necessarily choose to be their roommates. Let's face it. Sometimes they're living with other people that are maybe have got their own issues that could be, have detrimental impact on people. So this is a far-reaching situation that continues to be something we have to pay attention to. And I'm certain you wear your mask when you go out of doors, so I don't need
Uh,
to.
yeah, oh, yeah. Oh, absolutely. Always.
I,
Always.
I figured as such just based upon the little that I know about you. So you can do a strong reminder to all those families: wear your masks. This thing isn't
Yeah.
over.
And our son Aaron has learned how to do that so well. We're so proud of him, and he washes his hands. He tells me 20 seconds. He's learned so much too. So it's a big, community effort.
Well, I hope we can get Aaron back as soon as we possibly can. And I cannot thank you enough for your advocacy, for every single email counts, every phone call, anything you could do to let your state reps know that we're out here, and again, could really be fundamental in how we're able to proceed as an organization. Ruthie, we couldn't do it without families like you. Give our best to Aaron and to your son and to your husband Danny, and we will be talking to you again soon. I hope before
Thank
too long.
you. Thank you, Dan, for your leadership and for your staff. And we are so incredibly grateful to everything that you have done during the pandemic and before the pandemic. And we can't wait to have Aaron come back.
Thank you so much. Okay, we'll talk soon.
Bye.
Bye bye. Oh, I can't tell you how much it means to me. I'm a human being, and there are days when I'm feeling low, and I kind of. Well, my team probably knows like when those times are because I'll sometimes disappear for a little bit or just get my head like cleared around something. But getting these responses from our family members means so much. The next guest that I'm going to bring on board is Karen Meacham, whose son Michael lives in one of our programs, and Karen is somebody that I've known now for probably more than 13 years. Michael's been with us for a long time. And so, Karen, are you there yet? Hi, Karen.
Yes, I'm here.
Hi, how are you?
Fine, thank you.
Now, I don't have a chance to talk to you as often as maybe I once did because you've been around long enough. You remember when I was still probably in the residential programs on a regular basis, and of course, I know your son. He's been a fixture of our programs. He's been doing any number of housekeeping crews that have gone around and you jumped out my mind during a recent conversation because you took the whole idea of honoring people that have supported you some time ago after Michael had been one of the early people who came down with the COVID-19 virus, who was brought to our care center at the time. And you sent the most amazing set of thank you notes. If I remember correctly, you wrote a note of thanks to me and mentioned specifically staff that you wanted to honor for their service. I used that then, and specifically, I think I sent an email. I can't remember the details now, but I think I sent an email and copied our human resources department so that it would go into their personnel file. And then I found that not only had you done that, but you'd written individual notes to each of those staff to thank, or emails. I can't remember the exact details yet, but do you know how much that meant to us?
Oh, that's wonderful. Well, we
Really.
were eternally grateful for the care that our son Mike got when he came down with COVID right in the middle of March. And it was a terrible time, but we were so lucky to have you as leading us through this. Your talks twice a week were just very, very comforting, just
Oh,
to
wow.
know that you were out there. And so it was just a very natural thing to write those thank you notes. It wasn't, as they say, it was a no-brainer. Absolutely.
You don't know, I feel this way. It's been foundational to my sort of leadership, sort of perspective, and you just cannot know what it means. But just taking a moment to share a note of encouragement or just to, we hear about the negative things all the time, and in this era with this pandemic, there's a lot of negative stuff to be heard, and for a family member to take a moment to just say, hey, your staff are doing a great job. That is just like, oh, it's just oh, it's like ambrosia to my soul. And I appreciate that so much. So you've been you've lived by this philosophy. You've been a very supportive family member for many, many years, and so we've appreciated that. And then recently, with this call to action, you were telling me that you got a sort of a follow up from Nick Egoff, who is the manager of the program. What did Nick say to you guys?
Well, he wrote a very long, detailed letter telling us what the ramifications of these bills are and how really, really important they are. So essentially, he said, please take what Dan said into your hearts and just do some cutting and pasting and send it to your representative. So I sent it to Michelle Chicolo, who is
Hmm.
also our representative. And I found out she is sponsoring two of those bills, which you and Ruthie talked about. Her aide, Mason Heilman, was very receptive and got back to me. And I think he is someone that people could go to online. Also, the letter that I wrote, anyone could use it. It just kind of took what you said and a little bit of what Nick said and kind of put it together. So I'm absolutely ready to share that with anyone who wants to get in touch with their congressperson.
What would you
So I
say?
just have a question though for
Yeah, yeah,
you. Is it better to call versus email versus send a physical letter? Is one
So
better than the other, or should we
that's
do all of them?
such an amazingly great question, and it's something that I'd even thought about setting aside a couple of minutes and maybe doing one of my famous PowerPoint slides. But the hierarchy of I think if a legislator was talking to us right now, what we'd hear them say is the phone call, the personal phone call, is the gold standard for reaching out in advocacy. Because if somebody takes the time to make a phone call, and normally you're not going to talk to the state representative anyway, unless you
Right.
ask for a call back, you'll talk to their legislative aide. And these are men and women that are very, very well versed in all the legislative kind of activity and the legislative agenda. So they're going to be people that are going to be familiar with what you're talking about. Probably they are going to be in many cases, they speak on behalf of the state representative that they work for, and so these are people that you mentioned that you talk to an aide. So the phone call is the most important thing. After that, they say that if you send a written letter or note, that will in many ways kind of fall second because you've taken the trouble. It's almost like the more work it takes to do it, the more it means to them as far as how important it is. Taking the time to make a personal phone call, that's huge. Sending a note, putting a stamp on it, and then in email, which is sometimes a lot easier or can be generated by these big blasts. They maybe don't. That would be third. But in any case, they're getting counts of how many emails from constituents, how many calls. All of that goes into their ears, and they're thinking about these things when it comes time for a vote. Karen, I've got you for just a minute more, and I wanted to just switch topics a teeny bit. We've got Thanksgiving right around the corner, and Dan Lanen and I, in a moment, when I bring him on, are going to be talking a little bit about how we're thinking about our Thanksgiving, sort of, the procedures, if you will. Families are many have the routines of having their sons or daughters home for Thanksgiving. It's the number one travel date of the year or holiday of the year. More people travel around Thanksgiving than they do at during the December holidays, and yet we're wondering whether or not this is the best year for many, many people to be going off to many, many locations and then coming back into our homes. I mean, of course, our number one policy, I mean, our number one purpose and desire is that people are kept safe, that they're not exposed to the virus. A big concern that the providers are having is that as families have various people that gather, certainly the CDC is very worried about this. That people will be unintentionally infected with the virus, and then we're worried as a community that as they return to our group homes, that they're going to be increasing the likelihood that many more people get it. What are your thoughts on that? I mean, are you, in Michael's case, he's had it, so maybe he's got some resistance to it, but do you think families would be able to cope without taking their kids home if we tried to do something extra special in the houses to celebrate Thanksgiving this year?
Oh, that's an interesting question.
I put you on the spot. Maybe I should have done
I-
that. I was just
no,
curious from
I know that our family usually has 14 to 16 people, and so this year we're not going to do that. Now, Michael, so there will be just three of us, my husband,
Okay.
Michael, and myself. So it's just limited to them, and so I guess we're just limiting the crowd that's
So
coming.
maybe
Michael has come
that's
home a couple of times. He's always had his temperature taken when he
yeah,
leaves. He has his temperature taken when he gets
yeah.
back. Can I just go back to one thing though?
Sure
As
thing. Of course
far
you can.
as the call that
Yeah.
people can make, I would say have it written out what you're going to say. Have a little script, and just be short and sweet. And I think if we got maybe some direction from you saying, what are the points that I must make in this call, essentially what should people write down on that little 3x5 card before they make the call. So anyway,
Okay.
sorry to
So
diverge,
something
I
more
thought it was,
condensed than the letter, more condensed than the outline of the points. You want
yeah, it
the
would have to be something like let's see. I'm a parent. My son or my daughter is, whoever it is, and um, uh, benefits from the house management, the employment, the day programs, whatever it happens to be.
Mhm,
And these bills are very, very important, and to
mhm.
have the numbers of those bills. So if you just kind of say, could you support House Bill 454?
Yeah.
Whatever they happen to
So
be.
maybe more of just a cheat sheet for just like the talking points from the
Oh,
maybe.
exactly, because I think a lot of
Yeah.
people don't know, I'm going to pick up the phone. Okay, so I'm not going to get
Yeah.
Michelle because I'm going to get her
Yeah.
aide or
Yeah.
somebody, but it will be tallied no matter what you
Yeah.
say. But it can be short and sweet.
Yeah. Yeah.
Sort of
So
like Thanksgiving is going to be, getting back to Thanksgiving. It's going to be very, very, very different,
yeah.
and limited in people.
Yeah. So maybe that's the key. I forgive me for putting you on the spot with that, but I think that maybe in your case, I think our desire is to maybe just treat this in a case by case basis. Because in your case, if you're attesting to the fact that you're just going to have the three of you, then you've been doing that right along. That's not so much a concern. It's just if there were going to be larger gatherings, we would want people to
No.
make other decisions. So maybe the most people are thinking about it in terms of how you are, and so well, I'll say happy Thanksgiving to you now because I may not talk to you again before then. And thank you so much for being there for your advocacy, not just today and not just with our legislator, but in a more general way. In your supporting our staff, our teams, and letting the people that work for us that means so much to me know that they matter and they're important. I think a
They matter.
compliment from a family member is like the highest compliment that we can be paid. So
Oh, you're too
thank
kind.
you.
You're too kind.
Thank you. And you take good care of yourself, please, and stay healthy and safe. And we'll talk to you again. I hope soon.
Thank you. I hope your mom's better.
Thank you. I appreciate that. Bye bye.
Bye-bye.
All righty. Yeah, you know what? The biggest drawback in all these, I got to tell you guys, is that I talk too much. So I could talk to both of those mothers probably for another hour. They were probably like, "Get me off of it. Get me off this call." No, they were very gracious, and we're so grateful that they were willing to talk to us. So next up, we will be talking to Mr. Dan Lanen. He's obviously a fixture out here. I know I couldn't probably do a week without him. Dan is, of course, our Senior Vice President of Program Operations. And so with that, he essentially manages all of the operational needs. So Dan.
Hey, Daniel, how are you?
I am doing well. Good to see you.
Good to see you. Good to
So
see
you were probably like, what the heck is he doing? Talking to a mother about what we're gonna do for look at his laugh. He's like, that's exactly what he's thinking. And as soon as I went down that road, I said probably not the best thing to do. You know what we're doing here? We agreed that this is kind of an authority topic. It's something that's been foisted upon us in a way that we've never, we haven't had to think about stuff like this in this way before. So this isn't even something we can like necessarily call around and find out what is everybody else in the field doing, because every organization is doing things differently. You and I and I'm talking about family visitation and the holidays as we go into Thanksgiving, and then the December holidays that are right around the corner from that point. Every family's got a different setup, situation, plans, expectations, and we sort of agreed that we didn't want to have a very specific policy, but at the same time, really trying to encourage families to help us think about our number one objective, which is not letting this pandemic get away from us in our program. So far, we've been pretty lucky. Can we, not lucky, but we've been successful, let's say, in not seeing this kind of run away in within our own programs. Can you talk to us about, maybe quickly tell us like where we are as far as number of cases? How are we doing with that? And then, like how we want to be getting families to be thinking with us about getting through the holidays as safely as possible.
So yeah, I guess the first thing I was thinking during the time that you had Karen and Ruthie on was that I didn't know if I wanted to follow both those acts. I thought they both did very well, and enjoyed the conversation with both of them. And
they were great.
And I second the reaching out to legislators, because again today on the ADDP call as well, we just heard about the value that brings. And so I think what we all think, right, is everything's safer in smaller groups right now, and we know that there's some things that certainly seem like times that high transmission can take place and not. And so just sticking on the conversation of visitations and what people's plans should be for Thanksgiving, I think putting out a set policy and etching out these are our guidelines and these are our rules is not probably the best way to go for us. I think treating it like the case by case basis is the best way to go. And I think just having one standardized approach that after a visit that we'd ask, for the individual returning to the programs, come back with a negative test. And so we've sort of gone back and forth with that. We heard today from larger groups who are doing all kinds of different things as automatically making an in-house quarantine after people return from Thanksgiving to having people get tested, but having the parents picking up the individuals be tested before they take the individuals home, and then also then having the individual tested before they return to the program. So I think people and places are all over the place, and I think we're just going to try to put on the best Thanksgiving we can in the house. And so we made the decision to go ahead and get each house catered for Thanksgiving, so that the staff and individuals will have a catered meal for Thanksgiving, and really try to encourage people that if they do have a bigger celebration, to certainly allow their son or daughter to stay with us for the holiday. But if they did have a small gathering, we wanted to leave it so that they could join a small gathering as well. And so we're hoping the catered meal and really trying to up some of the things we're going to offer that day will if someone was on the fence, would lead them to leaving them to stay in the program for the day. So
yeah, I was sharing with you that not that I use this to inform policy with NuPath necessarily, but it does give me another perspective, and that is how I am hearing from my mother's assisted living community about the various restrictions or the various practices that they have in place. Of course, they're licensed through a completely different sort of state entity than we are at NuPath. But I received an email from their senior vice president of operations talking about the holidays and saying, yes, we know you all want to take your family members home for the holidays, but would you please consider letting us host them for the holidays this time, and we're going to put on this big spread. We promise you it's going to be nice, because their concern, of course, is what I just was sharing with Karen, that people are going to be going home to various, situations, and these are older people that are often, have, other, sort of medical, issues that make them more susceptible, possibly, and so our family's been like, oh, part of me is like, oh, I don't want mom to not be with us, but it's kind of a moot point for her because she may be, who knows where she'll be at Thanksgiving, but it is an issue that I think lots of people are talking about. So I think that upon hearing from you, it's the best thing for us to do is just continue to, express our primary goals in regards to how we want to contain the spread, and then take it, like you say, on a case-by-case basis. With how many times have I said to you, Dan, over the past couple of weeks, what is our fundamental goal here? When we're facing, questions about, should we, do we need to close everything down? We close this area down. If we have this, we're trying to anticipate what we may do, and we're fundamentally, we get down to it. What do we have to do to contain the spread? What do we need to do to make sure that it doesn't become more of an issue than it is? Because, if some organizations are facing a very high surge in the number of their cases, and we want to fight against that at all costs. We don't want this back in. I mean, that's just clear.
Yeah, no, I agree with that. I think everyone's motivation is to try to have some semblance of life happen, and things that people enjoy happen, but also try to certainly manage and minimize any risk of any exposure, should there be one.
So Dan, I want to just use the last couple of minutes that we have here together, and before we wrap up, sort of as an opportunity, maybe talk a little bit about maybe call it botched messaging last week, as far as the Martin Center, and you've had some sort of fretful responses, people talking about, oh my God, what does this mean? Or, are we going to be, do I have to look for another program for my son or daughter who's been attending the Martin Center? Do you want to just take a couple of minutes to try to explain, like, what this impact would be and we haven't reached a final decision about that yet, but it's one of the things on the docket. What would you say?
Right. Well, I guess, I to be quite honest with you, and I think this is part of the value of these weekly sort of get-togethers and conversations with the families and stakeholders, is because most of the mixed communication that came out in parents' confusion or guardians' confusion when they emailed or called was really derived by someone who hadn't been part of our meeting last week, or who got the information secondhand. And that was somebody's service coordinator hearing that the Martin Center was closing, and so they reached out to a family that attends the Martin Center who's been doing virtual programming, explaining to us that the service coordinator reached out to them and asked them to start considering other programs, and if they wanted to take a virtual tour of another program. And I think the service coordinator was trying to be proactive, but also, I think our family member was clear with what we said last week, which is the Martin Center is not open right now. It's currently, we have the ability to open it, and should the capacity arise that we needed to open that, or if the interest of a lot of people coming back, we'd be able to. But as of right now, we have no intention of doing that. And if we continue to not have the interest and not need that space, then we will, walk away from the physical site. That still allows us to carry sort of a temporary, to put a temporary hold on the Martin Center, and still have that program exist and be able to apply to have that capacity moved to another program. And so, the most simplistic way I said, I explained it to someone this week when I was talking with them, is, if they're doing remote programming, if they had the interest that they wanted their daughter to return, then we could serve their daughter right now at the at the New Boston Street location. And when, if the Martin Center, or when the Martin Center would open back up, they would be transferred back there. But right now, the physical site that they would be attending is the New Boston Street location. And that was their understanding from the beginning. They thought that their option was, if they were going to return to program, and that it would be at New Boston Street and not the Martin Center, due to the the low numbers of people being interested to return right now. And so so I think what I continued, I reached out to the area office directors for DDS and communicated what we've tried to communicate here, which is that is a reality, that we may give up that space, not give up the Martin Center or that they have, but give up that physical space. And so I think they understood the difference, and they will make sure they communicate that. But I guess the main thing I would say, or I'd end with, is that any needs that anyone has, and we've said this early on, and we've continued to say this all the way through, as we see higher positive numbers coming back, or just any confusion at all, reach out to who you've been in contact with at NuPath, whether it's me or whether it's your direct manager or a director, and just ask them the question. They'll be able to get you the answer, because I do think that if you're not as engaged as some of our families are, like the service coordinators might be, the message that comes from say DDS is a little more confusing. And again, it's they have a lot of programs that they have to manage, so I could see how it gets confusing for them. But
I think that in a way it's kind of it's fundamental to how our programs evolve. The Martin Center's this is the second address, the second location the Martin Center's lived in, where it is now, from where it opened. Of the Martin Center, it would just be like, if you move from one address to another, your family name doesn't shut down because you've left your old address. It just picks up at another location. So we're looking more at this, the Martin Center being really the individual, the people that attend, that are served there, the staff that have been connected to that program for so many long years, and not the physical structure of 300 West Cummings Park, which that address could be anywhere. It's just, for now, it's a cost that we have to consider as we try to think about how we're going to move forward in a fiscally sound way. Dan, is there?
Could I just add one more thing to that? And I think the one thing that really, in talking with the family member, helped them understand it, is that that staff that they were used to connecting with at the Martin Center, right, and those staff that they have, their daughter attended a program for quite some time, have been so helpful working in the residential component, or are working over here at New Boston Street location. And so that's some of the motivation to not open the Martin Center as well right now, is because those staff have been so helpful in us having to cover the residential component and the required, the additional staffing that it's requiring to run New Boston Street right now. And so, so I guess I wanted to alert families, or let them know that those staff that are, still able and willing to come to work, that we have tried to find locations for them all to go to. So, I think that's an important message. So
thank you for that. Hopefully that clarifies it for some families. And as you said, and you say again and again, if you have concerns or questions, we're not applying a rigid sort of grid here as far as how we're going to take action. We want to do this on a case-by-case basis, or whatever the needs are of families. Really look at each one and make decisions accordingly. Dan, in the last minute or so that we have, do you is there anything you'd like to add, or talk about any new cases or anything that you think we should be aware of?
Yeah, you did ask me that off the beginning, and I know we touched on that earlier. Yes, so we currently have one residential location where there was a positive case of staff having worked into the program, and so those people that live at that house have gone and get tested, and thankfully they've all come back negative. But because there was a direct contact with the positive staff, they are still in a quarantine period, which is difficult for this particular house, because some of those individuals had already had the virus, and so that's what's happening in one of the residential programs. And then another residential program is just about ending their quarantine period. for which they had a staff test positive there. That house has been quarantined, but no one has tested positive. And then as far as day services, last week in day services at the New Boston Street location, the upstairs and downstairs we really try to treat as two different programs. We have people go directly upstairs when they come into the building, and then we have the group of services downstairs. There was an individual we received the call on Friday that someone had been at home and they got results back that their son had tested positive. Well, the last day in program that their son was in program was Tuesday. And so we took precaution and followed what the Board of Health recommended and sort of went a little above and beyond. We sent the staff out to get tested immediately because we were running a test site that day. Sharon and the nursing team tested a number of individuals whose parents consented to them testing that was upstairs, and no one fell into the definition of a close contact with this individual because they did receive, they were in their own private room with a one-to-one staff. So the only person really in that direct contact exposure was the staff, the one-to-one staff, but no individual was in any direct contact with no mask on for a 15-minute period at all. But we still did, err on the side of caution, notify people, test those who wanted to be tested, and cleaned thoroughly once again over the weekend. But again, we're doing that deep clean every night. So I guess we're just trying to be as transparent as possible, and certainly want to assure people that we're not writing these rules and guidelines ourselves. We certainly reach out with the Board of Health, and Sharon and her team has been vigilant in following up with what their recommendations are. So
Dan, it's I know it's been an exhausting endeavor, and people listening, if it's not affecting them, it may just sound like a lot of words and a lot of things to kind of keep track of. I think the takeaway really for families is that we're lucky we have people like Dan Lanen, and more importantly Sharon Pitts and some of the others that are on the front lines of helping guide this, that are paying attention to the particulars, like what does this mean, what do we need to do, and how could we, as Dan said, exceed in many cases the safety and the mitigation efforts that we put into controlling this. Dan, as always, you're out there fighting the fight every day. Thank you so much, you and your entire team that continues to make sure we stay safe and that we can continue to pursue our mission even during these very trying times. So we'll talk to you again soon, okay?
Yeah, thank you.
Thanks so much, Dan.
Thanks. Take care.
All right, everybody. Mr. Dan Lanen, we thank him for his time. We're going to be wrapping up now. Thanksgiving is 2 weeks from today. Can't believe it. So we will see you next Thursday for a special Thanksgiving edition where we're going to be thinking about gratitude. Yes, even in the age of this pandemic, we have all so much to be grateful for. And we'll be focusing a little bit on that next week. I'm signing off now as your extraordinarily grateful CEO. Thank you all for your attention today. We need to be wearing our masks. We need to be washing our hands. We need to be avoiding situations where many people are together in close quarters, indoors. It's our responsibility to stay safe and to keep others safe by observing all of the guidance that we know now by heart and have heard 1,000 times over. We got this, guys. We will get through this together. I have no doubt in my mind, and I look forward to seeing you all healthy and safe next week at NuPath Live. Take care, everyone. Bye-bye.